What happens when depression and antidepressants meet the gut microbiota? In the context of the gut-brain axis, I've been always very interested in looking at how depressive symptomatology and the intake of antidepressant drugs can affect the distal organs. Indeed, we know very well what's happening in the brain. Up until a few years ago, we didn't really know what was going on in the gut, specifically in our microbiota. In fact, more and more research is showing that depression and several medications, including antidepressants, can have an effect on the composition and function of the microbiota, but also any changes in the microbiota can affect potentially efficacy and toxicity of medications. I just want to discuss with you the implications of this. For me, the most important implication is to use this knowledge towards personalized medicine, especially in a field like psychiatry where this is highly needed. For example, we could target the microbiome with probiotics, prebiotics, or other molecules as an adjuvant strategy in order to improve the treatment outcome for some patients. Or something else we could think of is to stratify the population based on their composition of the microbiota and see whether a patient will more likely or not respond to a certain medication. Of course, this field I think is very promising and very interesting, but we still need to address some challenges and limitations. In my opinion, the most important challenge that we face is the translation. So we really need to be able to translate any promising preclinical finding into clinical practice. So for me, this is the future of this type of research. If you're interested in this topic, I recommend you to read a few papers that I participated in. One is a review on the role of the microbiome in depression. I also looked at the effects of several psychotropic drugs, including antidepressants, on the microbiome composition. And currently from the lab, we also have some interesting papers. So one has been recently submitted, and it's a commentary on the link between antidepressants and the microbiota. So hopefully this will be available online soon. Previous work from the lab also looked at circulating microbiota in patients with depression before and after antidepressant treatment. Stay tuned if you want to know more, because we actually have an ongoing analysis looking at the fecal microbiota in depressed subjects. Thank you for listening.